Extreme situation seeks extreme measures. Today, we are faced with a challenge we are unheard of. The government and the authorities are working 24/7 to curb the spread of the novel coronavirus. The virus spread has opened up the Pandora box problems. A few among them are the doubts and uncertainties of people in home quarantine. In most cases, people in isolation are shunned by their neighbors and even by the family members at times. Let's hear from Dr. Florina Xavier, who works along with Chennai Corporation, coordinating volunteers who are social workers to make calls to the home quarantine people, combat loneliness, check on their well-being, sort out problems, organize essential service, and much more. These volunteers have set a great example of character-driven leadership by coming forward to serve the people at a time when the whole world is locking up to save themselves and each other.
For many of us, it's a very difficult experience being at home, not being able to do anything about it. And I had this rare opportunity of myself and my husband to help with the Chennai Corporation. And what we are doing is we are helping coordinate volunteers to make calls to those who are quarantined. There are different challenges actually doing this because, in fact, going out itself is a challenge. Many of our volunteers, they came telling us that it was so difficult to get permission from parents, from spouses, to be outside. It is dangerous to be outside, so that's why the government is asking us not to go outside. So that itself is a big difficulty to start with. Working in this kind of emergency situation is not new to me. I have worked in Sri Lanka during the war, immediately after the war. I have worked in Varda, in Thane cyclone, the recent Chennai floods. I have worked several years in Afghanistan. So, but they're all different situations. It's different because each has its own uniqueness to it. For example, conflict situation, you're always afraid to go out. You hear the bombs, you hear the shelling. With the floods, the cyclone, you know it's out there. Either you're intervening after the cyclone or after the floods. But this is very different because there's a lot of uncertainty, just like all the other situations. But this is unique in the sense that uncertainty, that things keep changing by the day and not knowing what's going to happen next, and to know that the whole world is locked down. So in a way, I think it's very unnerving to see that we are all in the same situation. Anything could happen anytime. So it's very difficult. We have about 35 volunteers in the morning and another 35 volunteers in the afternoon. And most of them are social workers, some of them social sciences, psychologists, who are helping make these calls. And one of the calls that I personally took was somebody who had to travel because his father passed away, and to make the arrangements and to see it through, and that he was able to travel was a big difference. Many of our volunteers are actually calling people, talking to them, helping them understand why this is important, why being in isolation, why being quarantined is important. I think at the end of all of this, there's a lot of hope. And I think again, it's the people that gives us hope. To think that 75 people just with one SMS message came together to make these calls to ensure that people are safe. And these are young people, young social workers. And every call they answer, they are talking to people and saying, how are you doing, what's happening? And I think this is what brings hope, that despite all of this, that we are together and despite the social distancing, we are together in spirit, and we are there for people, we want to help. And in this team, in the Chennai Corporation that we are doing this work, the team of doctors, social workers, engineers coming together, engineers are taking care of all the logistics. It's an amazing teamwork. We have fantastic leadership. The current commissioner, we have Mr. Prakash, IAS, and then we have Joint Commissioner Madhusudan Reddy, who is also IAS. I mean, these people are phenomenal in what they are doing, their vision, the way they are taking this forward. So I think it's a great feeling to be part of this team. Dr. Xavier, who's heading this whole volunteer coordination, Dr. Pradeep, who's the medical person. So I think just all these people and the volunteers working, I think this brings a lot of hope and knowing that we can overcome. So that's what I would think, that this will pass. We will be able to overcome this and we will come out of this really well. Thank you.